Welcome back. You're watching SA Today with me, Unati Pagyashe. Now, the French embassy in South Africa has drawn criticism for launching its own vaccination program. The campaign, which targets French citizens above the age of 55 living in the country, kick-started today in Pretoria and will begin on Saturday in Cape Town. The embassy says it will be using the Johnson & Johnson vaccine in its inoculation program. However, the health advocates are questioning the morality behind this decision at a time where South Africa is struggling to get their own vaccine campaign fully underway. Now, to explain their decision, we're joined by French Ambassador Aurélien Lechevallier. Ambassador, thank you so much for your time, and I apologize if I did butcher your name, but let's get right into the interview. Now, Ambassador, given that the current situation of South Africa, can you understand the frustration from some, health advocates that are criticizing this move by yourselves and saying that this is another form of vaccine apartheid, where Europeans are benefiting before Africans, even in their own country?
Thank you very much, Unati, for having me. And I think indeed it's important to get the opportunity to explain. You know that each country has the responsibility, a kind of duty to protect its own citizens. So that's why the French government decided to send a small number of doses abroad to protect the most vulnerable people of, for example, the French community in South Africa. It's also a matter of reciprocity. For example, the South African residents in France, they are vaccinated in France. So the French residents in South Africa, at least for the ones who are more than 50 years old, they can also get vaccinated. And actually, it's good for the South African vaccination program because these doses are saved for the South Africans and they are used only for foreigners. So all in all, it's quite small. We are talking about only 2,000 doses. So it's much less than the needs for the country, obviously. And it's something that we understand in terms of reciprocity and taking care of your own citizens.
Now, before we go into the actual vaccine that you will be using and that is currently running, in your program, as it were, not only in South Africa, but in other countries. Talk to me about the recent visit by President Macron. Did he table this matter with President Cyril Ramaphosa when he was here, or at the very least when they met again at the G7 summit?
Yes, actually, the French president brought these doses with him when he was invited for the state visit, and he mentioned that publicly during the joint press conference. And as you know, the two presidents, President Ramaphosa and President Macron, have been working a lot on vaccines since the beginning of this crisis. So they do everything on a very transparent manner. That's why they decided also to generate a multilateral, an international response to the vaccines crisis. And everything we did was obviously very, very transparent. And again, we are talking about, for these doses of vaccines, a very, very limited number of doses, only 2,000 doses, when, as you know, the vaccination campaign in South Africa will represent more than 30 million doses for the South African people.
Now, help me understand, and perhaps our viewers too. As you know, Johnson & Johnson vaccines were discarded in South Africa, I think up to about 2 million. So help us understand what authority approved the use of the Johnson & Johnson when it's understood that the batches, as I said, are contaminated and should be discarded.
Yes, maybe you remember that South Africa already received Johnson & Johnson. They were made in Belgium, actually, in the European Union, last February and March. So it's exactly the same products. These are Johnson & Johnson called Janssen. They are manufactured in Belgium, and so they were already approved in the South African market. We are not talking about the Johnson & Johnson doses that were unfortunately contaminated in Baltimore in the United States, and that just generated the delays that we are witnessing here in South Africa. But hopefully this will be secured and solved very quickly.
Now, Ambassador, talk us through your program. Exactly what does it entail? You mentioned 2,000 employees that work for the French government. Are we also talking about their family members? Talk to us about who actually is going to be getting this vaccine, both here in Gauteng as well as the Western Cape.
The French citizens and also the people working for the French embassy and the spouses and yes, only the spouses, not like the families broadly. So it's quite strict because we are talking only about 2,000 doses, and we don't want, to overlap with the South African vaccination campaign. So it's very focused and limited.
Ambassador, perhaps let me get your reaction as well as your response on the commitment that was made at the G7 summit that at least 1 billion vaccine doses will be made available to developing countries, especially African countries. What do we know about, when South African rollout will happen? Maybe talk to us about what you know about those vaccines that will be dispatched.
So South Africa and France and other countries created this platform called COVAX, and that has started already to deliver doses of vaccine throughout the African continent. For example, Lesotho received last week 36,000 doses of vaccines from France through the COVAX mechanism. Mozambique, for example, we received 100,000 doses from France through the COVAX mechanism by the end of the month. So it's underway. Of course, the President Macron and President Ramaphosa, when they met several times, they said that it's too slow, so they want to accelerate it. That's why we needed more commitments. That's what we saw during the G7 summit last week in the UK. France committed to invest 100 million euros in this doses campaign for African continent, and also announced that 60 million doses will be made available for the African continent by the end of the year. So we really hope that with these new commitments, the programs and the delivery of the vaccines will really accelerate in the days to come.
As an ambassador who is in South Africa and based here, and you mentioned that the progress of vaccination is slow, perhaps let me get your reaction to just some of the phrases that we're hearing, that South Africa is currently on uncharted waters, particularly Gauteng, with the high numbers, as well as we are in the eye of the storm, as the South African Medical Council has alluded to. What are some of the conversations that you are having with those in power that could potentially accelerate the vaccination program in this country, particularly since you are putting your citizens first?
Well, of course, we are following very closely the situation. And as you said, the situation is difficult here, but it has been difficult everywhere, including in France. France was very, very affected by the virus. Now it's getting better, but we had really tough times this year in 2021. So we're seeing that in South Africa, it's the third wave now that is beginning, and there is certainly a great need for an acceleration of the vaccination campaign. To be also very honest with you, the South African authorities have been very active, but they were unfortunate with the pharmaceutical companies, because they should have received, as you remember, the AstraZeneca at the beginning of the year, but it was not efficient enough against the variant. Now we have this problem with the Johnson & Johnson more recently, but this is not the responsibility of the South African authorities. I mean, it was very, very unfortunate. So I think we have also to put more pressure on the pharmaceutical companies to make sure that they deliver on time, that they meet also our expectations, and that they will give also part of their production to the most vulnerable countries to participate in this international response and solidarity response that we are calling for. So that's the kind of conversation we're having. And also, as you may know, France has decided with other partners, with Germany, with the EU, with the US, to support here in South Africa the companies, the private sector, to make sure that today and tomorrow, South Africa will have the possibility to manufacture its own vaccines, not only against COVID-19, but for the next also viruses and for all the needs in terms of vaccines that we have. So we will have a great deal of cooperation, of investment, of programs going on between our two countries. And that's actually one of the most important challenges of today.
Ambassador, thank you so much for your time this afternoon and for that update. Thanks for speaking to us. That was French Ambassador Aurélien Lechevallier. All right, on to this now. COVID-19 is